There's definitely differences in the system, but there's also opportunities. And so I chose Outpost nursing. And so for 5 months, I was posted in northern Newfoundland in a small town called Flowers Cove. I literally took a plane to a smaller plane to a smaller plane. The last plane was called Bearskin Airlines. It was a 4-seater plane. The beverage service was the pilot throwing me, a can of Coke from the cooler next to him. And we took off to Flowers Cove.
Hey everyone, welcome to the Nursing Insights podcast. My name is Stephanie and I'm a registered nurse practicing in the state of New Jersey. Getting right to it, the state of healthcare right now is tough, to say the least. Let's just say that the nursing shortage does not spark joy. We can sit in that and stew in it for a while, but we can't live in it forever. Things are changing. So join me as your host as I partner with the New Jersey Collaborating Center for Nursing to hear from nurses across the state about their experiences, trials, and triumphs in the nursing profession. Today on the podcast, we have Dr. Deeba Siddiqui, Doctor of Nursing Practice with a focus on safety systems. Deeba, thank you so much for joining us today.
Thank you so much for having me.
Deeba, you've had a fascinating career that's brought you all over the world and that has really leaned into some opportunities that maybe not every nurse realizes is out there in terms of developing your practice. Would you be able to tell us a little bit about why you became a nurse and a little bit about your career?
Absolutely. So, Stephanie, I think I've always been drawn to healthcare, right? As a high school student, volunteering, even in a dentist practice or, with the elderly. And so it was always a calling. And I was very focused, in my family, the message was be a doctor, be a doctor, be a doctor. So I graduated high school, did my degree in biochem, and very quickly realized I didn't belong in a lab. Like I truly felt just like I was dying. Every time I'd be sitting there, I was like, I need to get to people. I like people. And in my life at that point, I had a car accident. And it was one of those moments, right, where you kind of get hurt and you're in the hospital. And I remember I had a chest tube as a result. It was one of those serious moments in my life. And the nurses who cared for me inspired me so much. And it was like 3 a.m. I remember having that light bulb moment saying, this is what I want to do as I watch these amazing nurses, right, take care of everyone around us, including myself. So that would be when I pivoted. I applied to nursing school and the rest is history.
I mean, that's an amazing story to be able to say, I'm sitting here with a chest tube and say, this is what I want to do for a living.
I want to do this.
How old were you at that time?
Oh, I was 19. And so it was, my second year, I would say, of my biochem degree. And that was when I switched. I'm like, no. And it's honestly been the best decision of my life. I love our profession and I wouldn't do anything different.
Amazing. So when you switched into nursing, one of the differences I think we have between you and some of our previous podcast guests is that you went to nursing school in Canada. Anything that was interesting from your career starting off in Canada?
Yeah, I think, obviously at the very high level, right? Socialized medicine, there's differences in that even. Just, I remember coming to the U.S. as an agency nurse when I first graduated and having to do a billing sheet for, my dressing. I'm thinking, how odd is this? So there's definitely differences in the systems, right? Working within socialized healthcare versus in the American system. But there's also opportunities. So very quickly in my bachelor's degree, in your last year in University of Ottawa is where I went, you choose a specialty. And so I chose Outpost nursing. And so for 5 months, I was posted in northern Newfoundland in a small town called Flowers Cove. I literally took a plane to a smaller plane to a smaller plane. The last plane was called Bearskin Airlines. It was a 4-seater plane. The beverage service was the pilot throwing me, a can of Coke from the cooler next to him. And we took off to Flowers Cove. And I met the most amazing people there. I was based in the community health center. I had my own skidoo. We'd go off to emergencies, across the lake. I can remember sitting there at 3 a.m, doing everything from suturing to prescribing to delivering babies. And, just the realms of experience that I had in that setting were outstanding. So, it's an area of nursing that's not talked about often here in the States that I think, if there's anyone looking for a pivot, look up Outpost Nursing in Canada and go take a look.
That's amazing. So you were out there for 5 months as a nursing student. Were there other senior nurses available at the clinic with you that were guiding you through the process?
There was 2 senior nurses who were amazing. They trained and mentored me. And then what we had access to was, I called it a doc in a box, that it was like a teleprompt. And if we ran into trouble, we would call and, this physician would give us advice. So, yeah.
And then when you came back, did you compare your experiences with your colleagues, with your other nursing student friends who had maybe a more traditional, I guess, sense of what the nursing experience looked like?
Yeah. And I would say I've always had this love of travel, right? Doing traveling, nursing opened those doors, right? We can go anywhere in the world and practice our craft, if you will. So my colleagues in nursing school, there were 60 of us in our class. We all had such varied experiences, but this definitely cemented my love of serving the underserved, right? Or perhaps, right, community health nursing and meeting the needs in those spaces internationally as well. So that led to, work for me. We did volunteer work in Africa. I went to Malawi then the following year as a volunteer for 6 weeks. And we did children's immunizations and, just a variety of different doors have opened in that space. So it's been a great journey.
That sounds like an amazing journey. And could you tell us, because you've had this history, across your career, of some of the other highlights and interesting pieces that you think really helped shape who you are as a nurse today?
I think, when your intentions are always right to do right, no matter the role. So whether I was in the ICU or telemetry or internationally, our calling is always the same, right? To help those in need. And so as I look back at my career, right, there was these travel opportunities early on, and then I became a traveling nurse. So I came from Canada to the States, started here at a very small hospital in New Jersey called Union Hospital in a new grad program. There were 8 nurses from Canada, and we worked on the telemetry unit together. And we formed such bonds. We're friends to this day, right? Godparents to each other's kids, all of that. We're still close. But that experience of working here as an agency nurse, learning hospital nursing in this space, very quickly, I learned about leadership and education, and my career very quickly went in that direction administratively, like you had mentioned your background earlier on, Steph. And so, became a manager, a director. Then I said, well, let me go back for my master's. The key in all of that, I think, is never being a barrier to yourself. Right? I see so many nurses now who will say to me, what did you do? What was the secret? Like, how did you get to this place? And the answer is very simple, like to never be your own barrier. Say yes, never doubt yourself. And if you don't have the skills, you will learn them. So there's I think a core confidence that, everyone should have in their abilities.
And that confidence has brought you to your current role as Chief Risk Officer at Hackensack Meridian Health, which is amazing. So would love to hear about that, and also love to hear about your work that you've had the opportunity to do with the United Nations as Patient Safety and Quality Officer.
So let's start with the UN, and then I'll get into my current role. So I've spoken to you about my love of travel. And it's, fortuitous. Things always connect in our lives, right? When you look back, you think, oh, it happened the way it was meant to happen. I remember I was speaking at a conference at IHI in Florida, and we were talking about high reliability and patient safety systems. And there happened to be someone in the audience who worked at the UN. And they said, we could really use someone with your skills. We're starting an analysis of our safety programs in the field. Would you be interested in talking to us? And very quickly that led into a conversation to a full-time role. So I joined the United Nations in 2018 as their Patient Safety and Quality Officer. My mission was to visit all of the missions, right, around the world to develop a set of common healthcare standards. Now, for anyone who doesn't know, right, about the United Nations, we all know about it, but the UN, right, is built upon the generosity, right, of the countries. So well-off countries will donate funds. Third world countries will donate resources, often human resources, right? Nurses, physicians, they'll open up hospitals in mission areas. And when you have this variation, whether it's China who's donating a hospital or India or Egypt, there's variation in the standard of care. So my role was to go in, evaluate those standards, and then develop a common set of standards for all of the missions around the world. So it led to travel in Congo in the middle of the Ebola outbreak. I spent a lot of time in Italy because we had our headquarters there and we did a lot of training there. Many, many trips to Africa. And I'll give you one quick example. My first trip to Congo, as you're touring, right, the mission, there's soldiers, right? The United Nations, you see them, the blue hats, they call them, the blue hat soldiers. And there was a team of women soldiers, and I was looking at their information and their data and meeting people, and they had a very high rate of UTIs. So the common question is why, right? Why is there such a high rate of UTIs? And we came to discover very quickly it was a very simple thing. The restrooms were located nowhere near, right, the female headquarters. And so in the middle of the night, there was fear to go right through the mission on their own. And the simple fix was installing restrooms near the female right headquarters where they were stationed and living. And we saw a dramatic reduction in a UTI. So I think that's the key example of just using your basic nursing skills and saying, what's going on here and how can we fix this problem relatively easily? So yeah, the UN, oh my gosh, I have so many stories I could get into, but seeing healthcare through the global lens, right, with my background in socialized medicine, as well as working here in the States, really rounded out my view of, I think things that we can easily do within our own practices here to advanced care.
What an amazing experience that must have been. I'm thinking too, because you're not just evaluating standards from around the world, you're working in the different languages, you're working in those different contexts. What are some of the challenges that you experienced in trying to standardize something globally?
I would say shared understanding on what the problems were, right? So I came in very focused on safety because that's what I did my doctorate. And I assumed everyone had the same concern. Right? So I'm talking about safety and assuming that adverse event reporting and people are speaking up about things when they don't go right, because that's what we do here, I would say, in Canada and the States, right? We report errors, we learn from them. Some of the basics like that, having a place to speak up and report errors did not exist in these missions. So you're really starting back at square one and saying, what is the problem that we're trying to solve? And there's also a lot of suspicion, like, why are you coming in here to evaluate me? And what does this mean? Are you going to unearth something I should be doing that I'm not doing? So I would say developing common situational awareness was really the first struggle. Yeah.
And it sounds like there's also the denominator of trust that you're talking about, because how can you solve problems if people aren't willing to report or if they're not willing to open up and share with somebody who's coming out to evaluate them? So how did you build that trust with the folks you were working with at the different missions when you're going to so many places?
Right. I would say it's definitely going back to your true north, which is the patient, right? So we are all in this line of work to care and to prevent harm. And so if there's something that disrupts that and we can't talk about it, if there's a med error and we don't talk about how we're storing the medications, the next patient's going to get hurt. So we need to get better, right? We need to talk about these things, and no one's going to fix it but us. So it was really about having the conversation, creating a space where everyone could speak up and share and learn and remove power gradients. So Stephanie, one thing I'll tell you is when I joined the UN, it's very much a paramilitary structure, very hierarchical. And so I joined it as what they called a P4, which is a professional 4 category. Most of the nurses were not. They were not in the professional category. They were in the technical space. And I had nurse after nurse come up to me and say, my gosh, you're the nurse we heard about. You're in the professional. You're a P4. And I'd say, yes. And they'd say, well, no other nurses are. So that concept, right, of breaking the glass ceiling within that structure didn't occur to me until those conversations were happening. And I only share that example with you because today, right, there is a nurse there who stepped into my role who really didn't think she would ever be there. So anyway, it's just it's a good story of succession.
And I'm sure you're able to take those experiences too in terms of trust building and getting the surrounding kind of people who are in the field, who are doing the work, to be able to speak up and speak out and talk about it. That's something that you've probably been able to bring into your role now as Chief Risk Officer. Is that correct?
Yeah, you hit the nail on the head. At the end of the day, everything we do, right, requires space for everyone to speak up. And listen, we can always do better. But the core foundation of psychological safety undermines all of our work. How we speak up, how we learn, and how we get better. So yes, there's definitely crossover there.
And you were in the role of Chief Risk Officer during the pandemic.
Right.
What was that experience like?
So I started here in January of 2020. And if you recall, the first COVID patient was in March 4th. Right, of 2020, 2 months later. So I started here. I just left the UN, and I had a lot of paramilitary medical information, right? So I knew how fast COVID was spreading. And very quickly, I think my first week here, I remember meeting with my leader and saying, we need to stand up like preparedness sessions. And I'm sure there were some people who thought I was a conspiracy theorist, but 2 short months later, COVID very much came right to HMH and to New Jersey. Just a month later, what did we have? 2,200 patients right within our walls at the hospital. We were converting a cafeteria into a ICU. Things that we never thought we'd be doing, we were doing. And so the COVID experience here, listen, we did so much. I'm amazed by the colleagues. The silver lining for me was that it fast-tracked my connection with various people across this network in a way that would have taken me years to accomplish, right? Simply standing up a command center at the network level, things that we hadn't done before, creating those connections with all our hospitals and our sites, talking about redeploying teams to where they were needed. There were so many conversations that I look back on today that strengthened us as an organization. And really, there's people I run into in the hall to this day, and they're like, I've missed you. I miss being in the COVID network, command center with you. But yeah, it was one of the most amazing experiences of my life. Lots of learnings happened there.
And I can't imagine the amount of pressure it probably was as Chief Risk Officer during the pandemic at the helm of a large health system. Of all of the experience that you've had, being an outpost nurse, working at the UN, doing all of these missions, and then now taking all of those experiences into your current role as a Chief Risk Officer, where do you feel like some of the most valuable learnings have come from? And what do you think you'd want the audience to take away from that?
So when I started here, right, and we started the command center, the incident commander role, understanding the principles of, how to run a command center, all of the lessons from the United Nations and being in those missions, whether it was, I remember writing my spouse, just completed my landmine training, right? There were always emergency situations that arose. I found myself carrying all of the lessons over my career into that moment, right, of managing a large-scale disaster, if you will, or an epidemic or a pandemic. So whether it's taking an authoritative position, right, as an incident commander in that setting, or it's being compassionate when someone's calling into you in that setting and saying, I'm sick and I don't know what to do. I got sick at work and now I'm scared I'm going to give this to my family. Help me. Or I don't have an N95. What can I do to keep myself safe? All of those conversations pulled in on every aspect of my experience over the years, right? So compassion, command, right? All of those skills do play a role. Yeah.
Something that's particularly fascinating, I think, about your particular story is that a lot of times I think a chief risk officer or risk safety quality, those areas you've been, working through in your career, a lot of them seem very theoretical to people. They seem theoretical to me as a, practicing nurse. To be able to take those things and make it into a proactive, position and being able to take all of your learnings and guide your colleagues through that pandemic experience is pretty amazing.
Stephanie, I'll say, when you think about those experiences and what it means, it's really all back to the same thing though, right? To always do right, right? And if you can bring people together to achieve that end result, then you've done well.
And if you were interested in inspiring more nurses to explore some of those career pathways that you've gone into, what would you want to say to them? What were some of the draws that brought you into them?
I would say, if I look at my career, I would categorize it as non-traditional roles in nursing, right? And so whether it's learning risk management, right, which typically, yes, nurses, I would say it's a 50% bag, where half of us are nurses, half are not. The advice would be, right, to always go forth and try something new and learn about something, because nursing has such strong connections to so many different areas.
So, Deeba, your experiences have really brought you across a variety of care settings and a lot of opportunities to engage in public health nursing. So the American Public Health Association defines it as the practice of promoting and protecting the health of populations using knowledge from nursing, social, and public health sciences. Your work in Outpost nursing, your work in the COVID pandemic, the work that you did in the UN and going to all the different missions on a global scale, all of that can really be seen in the lens of public health nursing. Could you tell us a little bit about your thoughts on public health nursing?
Stephanie, I love how you phrase that, because in some ways, right, you really brought together all these experiences into one space. And I haven't even thought of it that way myself, but you're correct. That is the common link between all of these experiences. And when I was in that community caring for folks in Flowers Cove, right, that was definitely being the only healthcare provider, whether, right, the need was an antibiotic or delivering a baby, we were it, right? Me and two other nurses. And so you're right, that community enveloped us, right, within their embrace, because we were there for them. So meeting the needs of that population, whether it was in Newfoundland, like Flowers Cove, Newfoundland, or in Congo, the call was the same, right? The call to action was the same. And for me, the differentiator, when I look back, the reason it's such a strong call to action is that was woven into my education. I mentioned earlier, Canadian socialized healthcare system. There is a very strong emphasis in the nursing curricula on public health nursing. I did an entire semester on it. It was one of our focus areas. We did clinical hours in the community, working with the family. So intuitively, I felt very prepared to function in those spaces. And all of those events did ultimately lead right to the pandemic and our role in the command center. Because at the end of the day, public health nursing leaders, the one thing we have in common, right, is we want to make it better for those in our care. And whether that's, the leaders that we're caring for during, a pandemic, or the patients in the community. Yeah.
Something that's really brought to life through your experience that you shared too is that you were doing public health nursing for a community while still being the individual nurse rendering care. And you've also gotten to be the public health nurse looking at an entire mission site where you're looking for the care of both the staff who are working there, the patients who are being served there. What is the transformation in your thought process? Like, what are some of the things that change in your mind as you start looking from the care of one person to the care of a population?
Oh, it's such a great question, because I feel we do this all the time as nurses, right? You're always zooming in and zooming out, looking at the patient, lifting your head up and looking at trends. And we have these expertise as nurses where we're almost epidemiologists, right? In some sense, looking at infection rates and thinking of solutions. So nurses have this skill set, right, of being able to look very closely or look very high, right, at the problem. So your question is, what prepared me? I really think every nurse possesses this, because we have that ability, whether it's, education and you're teaching other nurses, right? Or whether it's educating one patient and their family on one medication and what to do when they get home. So I guess the core strategy there is compassion and understanding things from the other person's perspective.
And when you're starting to work at the community or population level, you probably have a lot of competing priorities versus, I think, in nursing school, we're like, okay, airway, okay, circulation, one major thing to preserve this person's life and function. When we're looking at communities or populations, there's probably several competing priorities. How do you start to triage those priorities?
Yeah, I will say one skill set I learned in my career, and I know it doesn't sound great, but it was process improvement. It doesn't sound flashy or exciting, but learning Lean Six Sigma, learning process improvement skills, right, helped me to weed out the noise and focus in on the problem at hand. One of my most common sayings, my whole team will hear me say this, is what's the problem that we're trying to solve? Because there's so many things that enter into a conversation that can take you off track. So stay focused on the true north, the problem you're trying to solve, and then solve for that and then move to the next thing. So I would encourage, right, any nurse out there to take training in those areas to expand those skills.
And once you're looking at the problem that you've identified and saying, what is the problem we're trying to solve? How do you start to shift towards solutions? What's the train of thought that you start to bring your team on?
Yeah, I think the key there is always to go to the experts, right? To go to those who are doing the work, to ask them for the solutions and partner with them on what would work best. So whether it's walking their process with them and then saying, what's inefficient? What doesn't add value? How do we redesign this process to achieve this goal? You get your best insights from those who are closest to the work.
And as you begin to implement, could you tell me, how do you think about success? So you have your problem that you want to solve, but there may be several metrics or several measures, especially in a time like COVID. It might be, okay, we're reducing infection, we're reducing rates of death, but in less, maybe straightforward scenarios, there might be a lot of ways to determine success. What does that look like in your process?
I'll give you an example. So my role as Chief Risk Officer, we look at adverse event reports. So I know this sounds silly, but it's a view into the psychological safety and culture of an organization. So when you look at their culture of speaking up and reporting either near misses or good catches or errors when they happen, if there's safety in speaking up about those things, you know that you've got a healthy organization, right? Because from there, you can build upon the learnings to prevent those errors. So for me, a sign of success is strong reporting, right? Those numbers are going up, people are speaking up, and they're trusting us to address the issues they're finding.
And then taking that information that they share with you and then doing right by it. I think you keep on mentioning that thing of compassion, and there's also a level of accountability and responsibility to make sure that you're honoring the commitment that you made.
Correct.
In creating a place of safety.
Correct. That is the most important part, is communication. I think it's always an area we can strengthen and do better on, but loop closure, thanking folks, right? Thanks for speaking up about this issue. We're doing something about it. That is one of the most crucial aspects that we can always do better on, to be honest. Yeah.
And if you had any nurses that were listening to this podcast and saying to themselves, I want to do what Deeba's done, what recommendations would you have for them?
I would say we just started an internship, right? A risk management internship, and we've brought in so many newer individuals into the space to help learn the profession. For any nurses who are, certainly within Hackensack Meridian Health, come work with us for a day, learn what we do, shadow us. That's, I think, the value is just by exposure, you get ideas and you see how you can contribute in the space, or if you're interested in that as a career path. Yeah.
And the final question we ask every nurse that comes onto our podcast is, we know that nursing is such a demanding profession. What is it that you do to take care of yourself at the end of the day?
Oh, that's such a good question. I took a deep breath as you asked it. So for me, it's always, I would say family, right? So my son, my wife, my siblings, my mom, it's just all in that space. But it's also outdoor time, right? Whether it's taking a walk with my dog for 20 minutes at the end of the day, just that simple outdoor air and breathing just makes everything sort of recenter. I've recently developed a love of golf and pickleball, again, outdoor activities. And I'm that person now, like a pickleballer every Sunday. But I think it's really important to have balance and then to fill your cup, because the work is stressful and they're long days, and you can really be depleted unless you take care of yourself and find ways to regenerate.
Deeba, thank you so much for sharing from your wealth of background and experience, and we hope to see you again soon. Take care.
Oh, it's been a real joy, Stephanie. Thank you so much.
Thanks for listening, everyone. We'll see you next time on the Nursing Insights podcast.